When treating an Achilles tendon injury, it's important to remember that recovery doesn't happen quickly. The physiotherapy stretching exercises you'll be given usually work very well indeed, as long as you do them frequently as instructed. If progress is very slow, then a full assessment to check for any underlying reason for this can be very important. Rest also plays a part in an optimum recovery. If the recovery is not going well, then scans can be helpful, checking the severity of the tendon problem and also highlighting anything else that may be contributing to the slow progress. In some situations, further treatments are required. Modern injections can be very effective at settling inflammation around a tendon. Treatment called shockwave can help rekindle the healing process. Thankfully, these days, surgical operations are very rarely required.